Alright, so first things first, I want to go ahead and be in the med room, and I want to go ahead and log on to my EMR. I will then select the Patients tab, select my patient, and select To Do. So the first thing we're going to do is go ahead and verify our patient's name and date of birth. So we have Michael Head, and their date of birth is 4/24/1944. We also want to note that they have a sulfa allergy, which for today's procedure, we will be administering digoxin, which does not interfere with a sulfa allergy. So the next thing we want to do is go ahead and review the medical order. So the medical order tells us that we are to administer the digoxin at 11 a.m., which right now is 10:45 a.m., so we are within the 1 hour before and 1 hour after window, so we would be okay to administer at this time. The other thing we also want to check is we want to check the date, and it is 4/16/21, which is today's date. So we have reviewed the medical order, and we once again will note the sulfa allergy. Once we've done that, the next thing we're going to do is go ahead and review our nursing implications of this drug. So digoxin is a heart rate regulatory drug. It is used for irregular heart rhythms. If our patient had an apical heart rate or pulse of below 60, we would want to go ahead and hold the drug, because then we would be causing harm to the patient. So before we administer the drug, we would want to make sure we do have an updated set of vitals and labs. The other things we want to know are we want to make sure we inform our patient that they can't have a high fiber diet before or after taking the drug, because this would interfere with the absorption of the drug. We also want to know any side effects. So digoxin can cause nausea, vomiting, dizziness, mood changes, and diarrhea. So once we are sure that we know all the nursing implications of our drug, we want to go ahead and log in to our AccuDose. And with the AccuDose, we want to go ahead and make sure that the AccuDose and the EMR line up. So we have the same patient, same drug, they do appear to line up. So at this time, for the first time, we would go ahead and go over our 6 rights of medication passing. So the first right is the right patient. So the EMR shows us that we have Michael Head as our patient, and so does the AccuDose, and date of birth is 4/24/1944, so we do have the right patient. The next right is the right medication. So this order calls for digoxin, and the AccuDose also lists digoxin. So we do have the right medication. We want to make sure we have the right dose. So for digoxin, we have a 0.25 milligram order, and we have a 0.25 milligram tab here in the AccuDose. The route is the next right. So the route in the EMR says oral, and the AccuDose states it is a tab. So because we can give tablets orally, we are confirming that we have the right route for our medication as well. The other thing that we want to confirm at this time is the time of administration. So it tells us that the due date or the due time is 11 a.m. and it is about 10:45 right now. So we would be able to give the medication at this time. The 6th right is the right to documentation, and we will make sure we do that after we pass the meds. So now that we've confirmed our 6 rights, we can go ahead and we can administer our medication from the AccuDose machine. When we receive the medication, we want to make sure we have the right drug. So we have digoxin, and we want to make sure that it is not expired and that our packaging is intact, which it is. So at this time, we can go ahead and log out of both the EMR and the AccuDose. And then we would be ready to go ahead and gather our necessary supplies. So we have our medication, a MedPass cup, a scanner, and we have a pill splitter, but we will not need that for this procedure. So now that we have all of our necessary supplies gathered up, we can go ahead and make sure that we enter the correct room and make sure that we are at the correct patient bedside, confirming with the patient's wristband. So once we are at the right patient's or in the right patient's room, we can go ahead and do our opening. So hi, my name is Corey Kaufman. I will be your nurse today. We want to identify our patient with 2 patient identifiers with name and date of birth. We can confirm that with their wristband. And we also want to explain the procedure. So today we will be doing a med pass procedure. And the last thing we want to do is make sure that our patient understands the drug that they're receiving today. So today you will be receiving digoxin. It is a heart rhythm regulator to regulate the heart rhythm issues you've been having. And we also want to make sure that they understand all the side effects. So once our patient is up to date, we are ready to go ahead and begin the administration of the drug. So the first thing that we want to do is we want to go ahead and log back in to our EMR in the room, and we will scan the patient's wristband. And once we've done that, we will review the allergies once again. It's a sulfa allergy, which does not contradict with digoxin, so we're okay there. And we will click the Administer Prescription tag. Once we've clicked the Administer Prescription tab, we will go ahead and click the Administer button. And at this time, we will go ahead and scan the drug. And once we scan the drug, we want to make sure to adjust the amount in the EMR if need be. And once we've done that, we will go ahead and scan the patient's wristband once again. So now that we've done that, we want to make sure that we go through our 6 rights one more time, just to be sure that our patient is getting the correct medication, we have the right patient, and so on and so forth. So first things first, we're going to look at the patient. It is the right patient because we have Michael Head here in the EMR with the date of birth of 4/24/1944, and that matches up with our patient's wristband and our AccuDose. Once again, we want to make sure that we have the right medication. So the EMR is telling us that we are administering digoxin today, and we do have digoxin with us. We want to make sure that we have the right dosage. 0.25 milligrams is what it calls for. 0.25 milligrams is the tablet we have, so we would give 1 tablet today. We want to make sure we have the right route, which is oral. We have a tablet, so we are able to administer this medication orally. And once again, we want to make sure that we have the right time. The EMR is calling for 11 a.m. and the time is about 10:50. So we are within the 1 hour before and 1 hour after the due time range. So we are able to give the medication at this time. So now that we are all ready to give our medication, we want to make sure that our patient is sitting upright and comfortably. I will go ahead and put my medication into the med pass cup and go ahead and administer the medication to the patient. While the patient is taking the medication, I want to make sure that I observe them swallowing, and if necessary, I'll ask them to open their mouth, show me that they've swallowed the pill. Once that I am sure that they have swallowed the pill, I will go ahead and document it and make sure to scan my ID badge into the EMR to ensure that it is well documented and my name will be on the file that I administered the drugs to the patient. Once that is done, we are going to go ahead and document everything from the drug to what time into the EMR. I'm also going to check one last time just to be sure that we did give the drug at the right time, the patient didn't have an allergy to it, and everything was done correctly. And make sure everything is documented into the EMR. Once I'm satisfied with it, I will go ahead and log out of the EMR and I will be ready for my closing. So I would make sure that my patient is comfortable, their bed was in the lowest position, their items are within reach, their call lights within reach, and their side rails are up ×2. And I also want to document all parts of the med pass correctly.